Metro Detroiters struggling to make do amid a shortage of ADHD medication. This has been an issue for the last 2 years, and it's one that impacts many people's daily lives.
Yes, it does. Last week, 7 News Detroit reporter Peter Maxwell spoke with a local pharmacist about what is driving that shortage.
Well, today he's asking a local therapist and a doctor about the impact it's having on their patients.
The shortage of ADHD medication has left those who rely on the medication in a state of panic and uncertainty. However, there are alternatives that you can be prescribed by your doctor to help you get through this ADHD medication shortage.
That's that I really think that we need to really come up with a solution.
Say tomorrow, not just a shortage, you can't get this at all anymore. What are you going to do?
And that's a real fear for Connor O'Brien and others with ADHD who rely on stimulant drugs like Adderall to function normally while fighting the struggles of ADHD. And for the last 2 years, the ADHD medication shortage has had severe impacts on those who need those medications, causing even more anxiety, difficulty focusing, and decline in overall quality of life.
With ADHD, it's very hard with transitions as it is. So if you can imagine getting medication for ADHD and then go into the pharmacy and it's not there, that causes a lot of distress, that causes a lot of anxiety.
Connor O'Brien has been on ADHD stimulants for the last 25 years and says he calls pharmacies ahead of time to make sure they have the medication.
I was forced to be hyper vigilant with calling pharmacies before having my doctor send in these prescriptions.
Justin Gillespie is the founder of Superior Center in Plymouth, and they specialize in therapy for those with ADHD.
We work with a lot of people on their daily behaviors. We take an executive functioning approach, a strength-based approach. We like to work with people on what they're already good at and build on it and just make them great at it.
It's really frustrating, but we're using the best tools that we can, which is really just trying to educate patients about the situation, adjusting doses.
Adults and children, along with their caregivers, have been impacted by this ADHD medication shortage. However, there are alternatives.
And a lot of times we're even switching medications to non-stimulants and seeing how that works.
And when it comes to younger children, doctors are trying to ask parents to stop giving the medications to their kids on the weekends so the medication lasts longer.
10% of kids are struggling with ADHD, 4% of adults, so it's a large amount of people that are affected by this.
Gillespie says adding therapy can also help people cope with daily struggles.
And that's a really important reason why you should be in therapy too if you are on medication, because we can spot some of your blind spots a lot of the time.
Reporting in Plymouth, I'm Peter Maxwell, 7 News Detroit.